My guest today is Professor Nathalie Mathieu-Bolh, who's Associate Professor of Economics at the University of Vermont. Her research focuses on the effect of tax reforms, optimal taxation, and consumer behavior. Welcome, Nathaniel.
Thank you for inviting me.
I probably mispronounced your last name, but that's the best I could do.
That's totally fine. Thank you for trying.
So you have very interesting research that you've been doing for a few years now.
Mm-hmm.
And I find this extremely interesting because I do some work, as I mentioned, in healthcare. So in primary care, for example, we look at hypertension, type 2 diabetes, COPD, and CHF. Probably about 60-65% of our healthcare spent in the US, or $4.5 trillion. And we find significant relationships in the EMR, electronic medical record data, that is related to obesity, BMI, A1C, which is, as you know, is leading to diabetes. So,
Yes.
So I want to start with your sort of overarching paper here from 2020. We are what we eat: obesity, income, and social comparisons. You said the empirical evidence of non-monotone relation between income and obesity is not well explained. We built a theoretical model combining income inequality and social comparisons to explain the link between income and obesity and study tax policy implications for fighting obesity. Obesity, as you have well explained here, has been a big problem, not only for the US, but for the world. And as we have 200 different countries in different states of development, let's say, in terms of per capita income, there is a huge sort of worldwide policy question here, right? So obesity appears to be a bad thing. It looks to me. So what do you find from this paper?
Okay, so first of all, you're absolutely right to underline that obesity is associated with a number of serious health conditions, such as hypertension, dyslipidemia, type 2 diabetes, coronary heart disease, and some cancers. There are in the US about 300,000 deaths per year that are attributable to obesity. And some studies indicate that obesity is the second largest cause of preventable death in the US after tobacco. So we know that it imposes enormous healthcare costs, not only for individuals. Obese individuals tend to spend an additional 42% on healthcare costs compared to non-obese, but it's also for economists an important issue because obesity has externalities. So it imposes social costs. These are estimated to be up to $210 billion per year in the US. And so what it means is that if it costs more to take care of obese people because of all the health conditions that are associated to obesity, then non-obese individuals face higher healthcare costs in the form of higher healthcare premiums or higher taxes that fund programs such as Medicare or Medicaid. So
yeah, it's really interesting, Nathalie. So Nathalie, it's really interesting. So so when we look at the data, I mean, we can see BMI, and so just a very crude comparison. We can see A1C, which is sort of a proxy for diabetes, type 2 diabetes. But BMI doesn't seem to have that much information compared to A1C. So the real sort of nagging question is, are there genetic differences among us? Some of us could be carrying high BMI and not have a problem, and others cannot. So what do you think about that?
Okay. Well, that's an interesting point. So that's true that it's challenging to have really perfect measures of obesity. But overall, what we see is that the question of obesity and health, or the connection between income and obesity, it's been measured many different ways. So some studies look into the BMI, otherwise look in more depth into, for example, adiposity. You know, they want to make sure that, of course, some people have a higher BMI because they have more muscles and other because they have more fat. So there are some challenges of this nature, but overall, it's really well documented that obese people, even if it's an imperfect measure, even if there are some differences in genetics or muscle mass, obese people have shorter lives and greater and spend a greater proportion of their lives with cardiovascular disease than healthy lives. There's an important study in the Journal of the American Medical Association of Cardiology in 2018 that debunked this idea that there was maybe an obesity paradox, that some of the past literature had suggested. The obesity paradox was basically some studies stating that people may be overweight or obese but may live longer. But in fact, it doesn't seem to be the case. These studies most likely were biased, didn't have really reliable methodologies. And so it seemed pretty well established that, you know, obesity, even measuring it imperfectly, even accounting for genetic differences, it causes a lot of conditions. And I think, you know, I mean, one simple observation is that people who are obese spend more money on healthcare.
Yes.
And that, you know, that is hard to get around. That's pretty solid piece of evidence in my opinion. Yeah. So that's true that part of the research I've done have focused on trying to explain the link between income and obesity, because there's this there are not many studies that studied the link between income and obesity. So in rich countries like the US, obesity tends to be concentrated among the poorest people in society. So especially poor women are heavier on average than middle-income women and rich women. And for men, there is more obesity among middle-income men than low-income men and high-income men.
Oh, wow. Yeah, that's quite interesting.
Yes. Yeah. And generally speaking, studies tend to show that in rich countries, there tend to be a negative correlation between obesity and income. It's really a problem concentrated on the poorest. But if you look at poor countries, developing countries, you have the opposite situation. It's the richest people who have the higher rates of obesity prevalence. And among middle-income countries, it's not very clear what's going on. So what seems to come up from empirical studies is that the link between income and obesity is a positive correlation. So the richer you are, the more obese you are in poor countries. But then this link changes with economic development. And in rich countries, the poorer you are, the heavier you are. So my co-author, Ronald Bender, and I tried to provide some kind of rationalization, of explanation for these empirical observations. It had not really been done before. And so what we thought of looking into was the fact that, you know, people's preferences tend to change over time. They tend to change as economies develop. This idea is not new in itself. It was grounded in the work of several famous sociologists. So one of them was Bourdieu, a French sociologist, who was explaining that as we become wealthier, we tend to change our taste. So when we are poorer, we maybe value more quantity. And with respect to food, that would be, having our basic nutritional needs met. And when we become richer, people's taste tend to change toward quality. And so, and this change in taste is connected to some peer effects and how we position ourselves in society. And so basically, what we found that idea relevant because there is plenty of evidence that to some extent, what we eat, the post, when we post about what we eat on Facebook, we don't post about a bag of potato chips, right? We post about a fancy dinner with wonderful organic tomatoes. So basically, there is really a lot of evidence, not only in sociology, but also in the empirical economics literature, that what we choose to eat, because eating also is a very social activity, what we choose to eat is influenced by what others eat, and it has, to some extent, it is a signal of status. And so we've built a model in which individual preferences change as they become wealthier. And as people become wealthier, they basically start developing a stronger preference for low-calorie, expensive foods compared to high-calorie, cheap junk food. And this model that we've built help us understand, help explain, in fact, this changing income obesity link over time and across cross sections of populations in poor and rich countries.
Yeah, so I mean, there are multiple interesting things here. One is, so suppose you rewind time back, Homo sapien history. I would imagine we had very little to eat 100,000, 200,000 years ago. Maybe we had one meal per day. And so there's that sort of a thing to think about, right? So the Homo sapien genes are really trained to expect food maybe once a day. And then we got sort of the agricultural revolution, maybe 5,000, just a very, very short period of time. We started eating a lot of stuff. Our bodies are not really designed to take all that stuff. Yeah.
And the richer we're becoming, so we always have this positive income effect that takes place, and that makes us eat more. And that's valid for all countries. So basically, the richer we get, the more things we buy. We buy more of everything, and we buy more food. Also because food has become relatively cheaper over time compared to other goods, and junk food has become even relatively cheaper to low-calorie food. So the fact that we over the centuries or the millenniums, we've become, we've managed to have higher incomes, have easier access to food. That's a positive effect that explains that as people get richer, they tend to be heavier on average. But then what we observe is that at the same time, there's a change in tastes that take place that can explain that at some point we have this change in correlation between income and obesity, from obesity being positively correlated to income to negatively correlated to income.
This is sort of the Kuznets curve that you talk about, right?
Yes.
It's really interesting. So I mean, it makes a lot of intuitive sense in this, when you start from zero, when you have something to eat, you eat. And at some point you stop eating. Well, you don't necessarily stop eating, but you eat different things, let's say. And the curve sort of an inverted U-shaped curve goes down. Yeah.
So there's, there's also other portions of the literature in nutrition that supports this idea. So in another paper that I wrote called The Elusive Link Between Income and Obesity, I explained that there's a whole literature called the literature on nutrition transition that looks into dietary changes that go with economic development. And so what we observe is that the richer countries are, the higher the fat intake in diets. So people get out of famine and starvation when they have a high enough income to put more fat in their diet. And this is really well documented. These are trends that have been documented everywhere in the world. An example there was a study in the Philippines that showed that people increased fat in their diet when they could start eating out and eating fried food. And as the economy developed, they ate more and more fat. And so we see that happening. And at the same time, we see shifts in the way people eat in rich countries. And among the rich countries, we see that people eat more whole grain, fresh vegetables. We observe that in the US and in Norway. So we have this, I would say, secular trends of higher income, more fat in the diet. Everybody on average gets heavier, but we have also changes in preferences that counteract that, and that explain that at some point we may have a Kuznets curve where maybe average body weight start decreasing, and at least we see an inverse correlation between income and obesity in rich countries.
Yeah, I mean, I know that you have done a lot of theoretical work around this. So income, I mean, a lot of this is sort of intuitive in some sense. So if you start from zero, as your income increases, you'll eat more.
Yes.
And at some point you say, I shouldn't be eating that much. Well, what sorts of problems?
Once you're out of starvation, your dietary needs are met, and you're in a society where, with when you are in a higher income category, society is such that you value more quality, more refined food. You have social interactions with others that make you value different things. That's part of what's happening, in our opinion.
Yeah, so I think you talk about this in another paper, but I want to get your perspective on this. So, weight loss programs, for instance, I always felt that the human body is a physical system. Calories in, calories out, you get stuff built up that's left over. So a human's autonomous systems, the brain gets 20% of the energy. We consume about 2,000 calories if we sit on the couch all day. And if you go on a treadmill 18 hours, you can burn about 400 calories. So in the grand scheme of things, it's very little that you can affect by exercise. If you put enough calories into the system, it is going to show up somewhere. It's physics. It's not biology or chemistry anymore. It's physics. Yeah.
Well, there's the widely accepted equation that's widely accepted by nutritionists and dietitians, which is called the Scofield equation, which basically states your weight gain represents your net calorie intake minus calorie expenditure. And you're right that calorie expenditure matters, but calorie intake matters even more to explain the rise in obesity. And you summarized it pretty easily. And I mean, it's pretty easy to gain weight or lose weight, by eating too much or starving yourself. You have to spend a lot of time on the treadmill to lose a few pounds. So, so that's why it's relevant to try understand better how people make decisions and what can be done to change the environment in which they make decisions with adequate policy making.
Yeah, so Nathalie, is that well understood in the sense that there's a big exercise industry, and many of them sell their products to sort of get in shape, they say, reduce weight. And you spend 6 hours on a treadmill and you go eat a hamburger, that's the end of it. I mean, you just you just spend 300 calories and then you took in 400 calories, right? So is this a well understood phenomenon?
So what I can say is that in the studies that look into the reasons why obesity has risen, clearly the increase in calorie intake is the number one responsible factor. Now, the fact that, instead of working in physically strenuous jobs, we spend a lot of time sitting at a desk, it also matters. And with COVID and the fact that so many people worked from home, and, we know that the lack of physical activity clearly plays a role, but it doesn't seem to be the number one factor in explaining the rise in obesity. So that's why we focused on food consumption so far.
Yes, I want to go into that a little bit deeper. So you look at income as sort of a driving factor for obesity, and it is sort of there's a conflicting set of factors there, right? So if you have zero income, you have nothing to eat, you lose a lot of weight. I just is putting it bluntly.
Yes.
If you have some income, then you have an option to select what types of food you want to eat.
Exactly.
And if you have limited income, then you don't have too many options in some ways, right? So is that what's driving this phenomenon?
Well, the basic approach in economics is to say, well, people, they tend to make choices, they tend to act in their best interest with facing a number of constraints and having access to sometimes certain information. So I'm not saying that we always are perfectly informed or things like that, but basically we tend to act in our best interests, accounting for constraints such as there's a limited budget to buy food. And so in a pretty, straightforward environment like that, in one of my articles called Could Obesity Be Contagious? And another article also, the hand-to-mouth consumption and calorie consciousness. I show that in fact, as long as the relative cost of high-calorie food is less than the relative energy density of high-calorie food, we're bound to gain weight.
Yeah.
So basically, we are acting as making the best choices we can in the sense that we like to eat food, but we don't like to gain weight. Okay, so in terms of preferences, we are trying to balance our taste and willingness to eat against the backlash, which is weight gain. So we're trying to make the best choice we can to satisfy these preferences, accounting for our budget constraints. And in that environment, basically, the model has a pretty straightforward and robust result, which is to say, well, if you are in an environment where the cost of low-calorie food is really low compared to high-calorie food, and this relative cost of low-calorie food is less than its relative energy density, you're going to gain weight. So yeah. That's one important element.
So let me see if I understand this, Nathalie. So you consider a human system as sort of a physical system. Calories in, calories out. Whatever is remaining is going to create weight. I mean, we can escape that. That's physics. And then the question is, what do you put in? What do you take out? And what you put in is a function of income, as you argue in many of these papers. Mm-hmm. And it's a function of two things, right? It's a function of what is available. 100,000 years ago in African savanna, nothing was available. Mm-hmm. So you have to go hunt for it. In the US and EU today, you have hamburgers, you know, all sorts of things that is available. That is, some of them are very cheap. Mm-hmm. And so the decisions that humans make in the modern savanna, so to speak, mm-hmm. are very different, right? I mean, that is what's causing this problem.
Well, I think that it's part of it. You know, we make choices. I mean, part of the problem of obesity is, I would say, an environmental problem, right? We are making choices in an environment we're confronted with, and the environment we're confronted with, food is generally abundant, relatively cheap, and especially high-calorie food is relatively cheap, and so basically that is a very important element why we are gaining weight. Now, what there are other factors also that matter, like, you know, of course, how much money we have to spend, what our friends eat, so a number of factors, but relative prices really matter, and that's why economists have been working for years, and including myself, on trying to explore what policies could matter, and whether taxing junk food, for example, or subsidizing lettuce would potentially be a way to address obesity. To, you know, if low-calorie food, and it is, if the relatively low cost of high-calorie food is driving obesity, then one option is to make high-calorie food relatively more expensive. And we can potentially do this with junk food taxes.
Right. If you go to all the way the other side of this part of the question, I have no opinions here. One could argue that maybe if you eat a lot and you get obese, let's say, and you get to hypertension, type 2 diabetes, COPD, CHF, variety of diseases, then you could be held responsible for taking care of those diseases, right? So there could be an incentive model, there could be disincentive model in some ways, because it seems like we are a little bit further away from the incentive model implementation. We have very high obesity in the US. I'm just looking at it from a US perspective. What do we do now to bring the system back to normality? Yeah.
Okay, so what you're suggesting, I think it's something really hard to implement, because let's say so basically to eliminate externalities related to obesity, you would like to have people internalize the externality, so pay fully the cost associated to some decisions they made related to food consumption. But then it means that, you would have to consider doing this for anybody who for example smokes. Then they have to pay for lung cancer treatment or things like that. And I'm not sure it would be the right approach, because also you could say, well, someone became obese maybe because of factors such as genetic factors or
Right.
extreme stress in their lives they had no control of. So it's a bit, I think, difficult to implement, and also probably would start opening, a can of worms with respect to discrimination laws and things like that. I think there are other things we can do to address obesity. So one thing that has been barely explored, it seems to me, are junk food taxes. About 2/3 of the states have implemented taxes on soda.
Yeah.
But these taxes are ridiculously low. They are, like, I think on average less than 5%. So imagine whether you buy a can of Arizona iced tea for $1 or $1.50 is not going to break the bank, right? It doesn't seem to be a serious approach to using junk food taxes. So I think they have not been implemented properly. What studies tend to show is that we would need at least a 20% tax to start seeing effects. And the tax should be broadly applied. You don't want just to tax soda, but maybe, sugar sweetened beverages in general, for example. So first of all, I would like to see junk food taxes implemented on a broader scale more seriously before we throw them away as an unviable option.
No, I like that a lot. So I'm a big proponent of consumption taxes, and I haven't been really thinking about food. But it is sort of if you sort of internalize all the societal costs that come with bad food, let's say, then if you have the right tax regime on that bad, then society will improve from there, right? So, but can we go out and, I think we can. We have a lot of data now. We could actually demonstrably show if you don't consume a healthy food diet, your chance of progressing into hypertension, type 2 diabetes, COPD is very high, And we have this COVID-19 thing going on now, and your chance of dying is a lot higher, a lot higher if you don't do that. So
issue for that. Yes. So yes, I think overall, there's still an argument that's pretty strong in favor of junk food taxes. I haven't seen a serious implementation of them. Arguments against, I feel, are not very convincing. So the argument, I think sometimes people imagine that junk food taxes are almost like a strict regulation that will prevent them from drinking any soda, and that is not what it is. In fact, a junk food tax simply is going to or a tax on soda is simply something that would result in a lower consumption. So you don't prevent people from anything. You just make them drink or eat more reasonable portion ultimately, when this works.
And the guy who pays $10 for that big can of soda will still do it.
Yes, absolutely. But what we know, I think what's convincing is that, for example, taxes on cigarettes, they resulted in reduction of cigarette consumption. And cigarette is super addictive. Nicotine is super addictive. So I mean, there's a chance that this would work pretty well on food. The other argument against that I hear is that junk food taxes would be unfair and really affect negatively the well-being of lower income categories. So with respect to this, I think it's not a very good assessment of well-being that I've seen in papers stating that, because well-being is made of how much you consume, and you may like to consume junk food. I mean, I like potato chips too, you know, but it's also a question of how healthy you are. And so you can't just say, well, people will be miserable if they don't eat as many potato chips as they want. You have to realize that also they may eat a bit less potato chips, but maybe also healthier. And so I think there's a lot also to gain in terms of well-being. So that's why I'm not very convinced by this type of argument. And another option is that we could also potentially offset junk food taxes with subsidies to healthy food like lettuce or fresh fruits and vegetables. But on the subsidy side, both what I've done with my co-author Ronald Vendner and other things I've seen in the literature, it's not convincing that it would help with obesity, because subsidies have a positive income effect. And if you have a positive income effect, people tend to eat more and gain weight. So it's not sure that it would work so well.
Yeah, I mean, I had advocated before that an advanced society will send healthy food to everybody. Because if you get a population healthy, the downstream consequences of that is very, very high net NPV, right? So, but we don't have an advanced society. We are sort of a mediocre. So I want to touch on. So go ahead. Sorry.
Yeah, no, I just want to say we're not cavemen, but we're still pretty primitive somehow.
But I want to touch on one thing that you mentioned in one of these papers, and that is you say, could obesity be contagious? Social influence, food and consumption behavior. So I found this very interesting. And so you take social cues to make behavior modifications.
Yes. So
and society forces you in some sense to do some things, right? Yeah.
Well, so yes, eating is you know, we are social animals, right? And eating is part of social activities, the social activities that we do, and social interactions have been shown in the empirical literature to influence our own body weight reference, our food consumption behavior, and our body weight outcomes. So, for example, there was a study in France that showed that social norms and the average body mass index influence our ideal body mass index, which influences our food consumption. And there are lots of studies that also show that our perceptions of overweight and dieting are influenced by a person's relative BMI rather than absolute BMI. So all that is just to give you a couple studies in, you know, a larger number of studies that basically our social interactions influence the way we behave, but it influences the norms we refer to, which itself influences our behavior. Yeah. And so in economics, initially, there's a framework that describes our food consumption choices as a pure rational choice, where people basically perfectly count calories and perfectly assess their mortality risk. And I thought that we should look into what happens if we build a model that accounts for social interactions and social norms. So our assessment of mortality, we know that it is influenced by others and that we systematically tend to understate it. So, for example, people who smoke think they have a lower mortality risk than others who smoke as well. People who overeat think they have lower mortality risk than others who have the same bad behavior for their health. We always tend to understate the risk for ourselves, whereas we recognize it for others. So in the model I built, I introduced the fact that that this type of assessment, we may have the wrong assessment about our own mortality risk. And because we see society where everybody is obese and overeats. And the second thing is we also, because everybody is heavier and heavier and overeats, we also tend to underestimate our net calorie intake. And that is consistent with studies that show that pretty much we consistently understate our net calorie intake. So there was a study in Great Britain that showed that almost 80% of people understate their net calorie intake systematically, and they understate it by 20%. So basically these social interactions, I think, influence our decision making in the way we appreciate. Basically, we count for calories. We are less calorie conscious as a result of social interaction, and we understate the effect on our own health. And the problem is when the social norm becomes heavier and heavier body weight, which has been the case over time, we have systematically over and over a misassessment of how we should eat that drives us to being obese, basically.
Yeah, so Nathalie, it seems like a sort of a runaway train problem here, right? So if everybody is sort of trying to get to the average, so to speak, and the average is going positively in one direction, you would ultimately get to, the average keeps increasing. So you say, when I go out, I look at people, and I'm talking about obesity now, and they say, well, I'm not better than those guys, so I can eat a little bit more. I'm just making this simplistic. So it keeps going up in some ways, right? Is that what you find?
That's exactly it. And so we see that social norms have changed over time. So one striking example that I give at the beginning of the paper is the change in clothing size labels. So nowadays, a woman who has a waist of 25.5 inch wears a size 0. And in 1958, that corresponded to a size 12.
That's awesome.
So basically, body norms have been changing toward being heavier and heavier. And I think with these norms changing, well, then it becomes more normal to eat large portions of food. So that's one thing. And the other thing is, because we have this optimism bias, we eat more, even more so willingly, that we don't really realize it's going to kill us. so that's all that creates a dynamic that contributes to explaining the rise in obesity. Because the rise in obesity, so it's connected to the rise in income, it's connected to the decrease in the relative cost of junk food, but that doesn't explain everything. So there are all other aspects of, I think, social dynamics that basically are captured in my model and help explain why obesity continues to rise, for example, whereas the decline in the cost of junk food has leveled off since the 1990s and cannot really explain the recent rise.
So I don't know if you looked into this. And so if there are no incentives in the system to be healthy, which is the case in the US, we have providers, physicians, payers, patients, and manufacturers. None of these four cohorts of people have any incentive to make people healthy. So that's a system that we have today. In countries, I don't know if these exist. I grew up in India. I don't know what the situation is there now. The insurance industry wasn't very well developed.
Okay.
And so in some sense, you had an incentive to keep yourself safe in some ways, right? Because you cannot really push the cost out to somebody else at a later time. So have you looked into sort of a country specific, I don't know about the situation in Canada or France or whatever, yeah.
So if you look at data, basically on every continent in the world, you've had a rise in obesity. And in India as well. Actually, I gave a talk last week in India, and I took the opportunity to look at data on obesity. So obesity is rising, and basically it's rising especially among women, and the sum of basically overweight and obese women are going to represent, there's going to be more than 50% of women overweight or obese by 2040 in India. And I think for men, it's 40 or 45%. So, and there's a stronger rise in obesity in urban versus rural areas, I think, as well. So, so it's a problem that is happening all over the world. You're right to say that the incentives are different depending on, taxes, subsidies, healthcare systems that are in place. But it seems that when countries become richer, they tend to face this problem more and more. There is now in the world, I had this striking figure, and in the world, the majority of the world population now lives in countries where being overweight or obese kills more people than being underweight. So it's a problem that's, increasing, and basically this problem with others threatens the sustainability of our healthcare system. If we want healthcare system such as, the one in the US, or other countries, but basically a system where individuals are part of a pool of insurers and do not pay for, and where their healthcare cost represents the cost of the average of the pool of insurers, whether you have a public healthcare system like in France or Canada, or private health insurance systems with large pool of insurers like in the US.
Right. So it seems to me that for 100,000 years, we didn't have enough to eat. Now we're eating ourselves to death. That is really what's happening, right?
Yeah, for sure. There is that. Yeah. I think there might be other things as well that I started working on, and it seems to me that another thing that can explain, as not for example, the discrepancies we see between poor people in the US and rich people with respect to obesity might also be related to stress and coping mechanisms.
Yeah, that's what I want to go into one of your later papers. So it's very topical. Economic stress and body weight during the COVID-19 pandemic. You say COVID-19 pandemic has caused income loss for many households, disrupting food consumption patterns and contributing to weight loss for some and weight gain for others. So you say I built a dynamic theoretical model that explains those empirical facts. The novelty of this paper is to incorporate stress caused by a lower than ideal income, which is economic stress, in a model of optimal intertemporal food consumption decisions made by a rational eater. So COVID-19 is sort of an interesting experiment, right? Many households had significant income loss, and so the decisions that we made pre-COVID-19 on how to eat, I would imagine substantially changed post, right? Is that what you're finding?
Yes. So basically, clearly, so COVID-19 has resulted in income loss for people, and for some, the income loss has been so significant that it has resulted in food insecurity and weight loss. And for others, what happened is that they stayed at home, didn't exercise at all, were very sedentary. That also can explain that some people gained weight. But that's not all, because COVID has also caused an enormous amount of stress. And part of this stress is what I call economic stress. So basically, my motivation there was to connect the medical literature with the economics literature, because in the medical literature, it's a well-established fact that stress causes obesity. It seems to be really well established. And in the economics literature, we know that people who have a lower income in rich countries tend to be more obese. So my point in this paper is to say, well, when you have an income that's lower than what you're used to or what you desire, or you lose income because of COVID, that causes a lot of stress. And then with stress come coping mechanisms. And we have a coping mechanism that can help us alleviate stress. It's to eat highly fat or sugary food. And so basically in my model, I incorporate the fact that stress can be caused by a trigger, which is income loss. And people to some extent can cope, offset this shock by eating more. But there's a limit to how much they can do that, because they don't want, because if they're overweight, they also don't like being overweight. So they have to also balance their stress level with their desire for junk food and their and the fact that being overweight becomes really unpleasant, or it's something they don't want. So basically the idea here is to say, on the one hand, you have the negative income effect that could explain that people lose weight. But on the other hand, you have the stress effects, and stress can also make people eat more. And so these two effects compete. And if the stress effects dominate, people will gain weight. If the negative income effects dominate, people will lose weight. So the model helps capture these two types of outcomes.
And the conflicting effects. So let me ask you sort of a loaded question. So from a policy perspective, would you be better off in an economic shock like COVID-19, would it be better off sending people good food rather than money?
So I don't know about that. If you send them money, I mean, you could imagine things two ways. Okay, so you send them money, maybe you will alleviate the stress caused by the loss of income, and they won't do the coping mechanism and they won't overeat, and basically that's one way to alleviate stress and overeating. And if you send them healthy food, well, maybe that will matter to alleviate the shock. It's possible. I don't know which one is better. You know, if you really want only to, maybe if you care only about the health and obesity question, you want to send them healthy food. If you care about other aspects of their stress related to income loss, you know, so maybe because of income loss, they can't buy the food that they need, but maybe also they can't pay their rent or their telephone bill, then in one case, maybe it's better to give them extra income. In the other, it's better to give them healthy food.
Yeah, I mean, if I were the king of the U.S. and look at the data, and then say 20% of my expenditures is on healthcare, 10 to 15% on crime, and so if I were to make the country better, I have to really focus on these two things. I mean, if I don't get these two things right, it doesn't matter what's going to happen in the future, right? So in a shock, the question would be what the right. I mean, I'm still unclear what the optimum policy might be for the country.
Yeah, I'm not sure either. I haven't looked into this specifically. It's a complex question, you know, with COVID. I mean, yeah, what to do in this context? It's I don't think we have defined really what the optimal policy would be in that context. You know, we want to shorten the length of the pandemic to prevent very negative economic effects and also negative effects on our healthcare system. How to achieve the best outcome, I'm not sure. It's still an open question.
I mean, in the US, we have a group of people who wants to send people money. There's a group of people who don't want to send people money. That's what we have in the US politics. Some people want to send them a bunch of money. Some people don't want to send them any money. And neither of these people seem to understand sort of how people live and what the sort of the long-term effects of stress, as you say in this paper, behavioral health issues that lead into physical issues later, obesity that has a variety of physical issues. So what we have in the US is we don't have politicians who don't really have a good understanding.
Yeah, I think they don't
how the country works. Yeah,
they don't listen to economists enough. That's for sure. You know, I think it's really we tend to see the same pattern among politicians. On the left, they want to give people a lot of money, generally speaking, because they think of the benefits, the consumption smoothing effects, the positive effects of, you know, helping people with giving them money. And on the right, people are focused on the adverse effects, what economists call the moral hazard. So basically, if you give people money, you can also create adverse incentives. And I think what's powerful with economics is that we have to build models that account for both effects and try to measure both effects. What are the benefits? What are going to be the benefits, and what are going to be the adverse effects? And for us, we're going to have to find out how to tailor these programs and, you know, find how much, if any, money should be distributed to people who lose an income due to the pandemic, and for how long, and things like that. So I think that's basically what makes economics interesting, is that it forces us to be non-ideological and look at the good, the bad, and the evil in all programs, and try to design them the best we can. But with respect, you know, to how to address the obesity crisis, and how would people respond to various programs, the truth is there's still a lot of work to do, you know, and we don't have definitive answers. That we still need to do a lot of work, but I think we understand a bit better what drives the obesity crisis. We have some ideas about policies regarding taxation or education programs that would focus on, you know, what's a healthy weight, for example, what's a healthy weight norm. There are things like that we probably could do that would help address the problem.
Yeah, I hope so.
Well, we're going to have to at some point, I mean, our healthcare system, if we want to maintain it or maybe expand it at some point, if we want to make it sustainable, we have to care about the general health of the population. You know, a healthier population is a cheaper population to take care of. So
yeah, I mean, it's a little bit off track, but so COVID-19, 80% of the deaths are in a cohort of above age 65. So, you know, if somebody were to devise a way to save Medicare, and being too crass here, this would be it, right? And so, you know, what is sort of the right policy idea here? We have a disease that seems to kill people who are older, fatter, less healthy. And the rest of the people might say, "Oh, that's okay." I mean, I have heard people say that. You know, there's a senator from Texas who says, "Yeah, that's good. Yeah, let's do more of it."
As long as it doesn't affect him directly, I'm sure he's going to be okay with it. Yeah, well, you know, ultimately, this type of questions, they also boil down to what people want for society, and everybody has a different idea of what's morally acceptable or not. And economics does not really have a lot to say about that. I think what economics can be used for is a tool. Once society has decided what goal it wants to reach, or then economic models can tell you how to reach that goal with this policy. But ultimately, you know, yeah, so it's going to be up to society to decide what's acceptable or not with respect to COVID, for example.
Yeah, I'm not too optimistic based on what I see. But hopefully we'll pull through this and get better. So this has been great, Nathalie. Thanks so much for spending time with me.
It was great talking to you. Thank you for inviting me.
Thank you.
Bye-bye.
Bye.